3 strength exercises every adult should do. Most people think losing strength is something that happens suddenly when you get old. One day you feel strong and independent, and then somehow, years later, climbing stairs becomes difficult, carrying groceries feels heavier, and getting up from the floor requires help. But strength usually does not disappear overnight. It fades quietly. You stop lifting heavy things. You sit more. You walk less. You avoid movements that feel uncomfortable. And little by little, your muscles, balance, coordination, and confidence begin to decline. The good news is that you do not need an expensive gym membership, complicated equipment, or a 2-hour workout routine to protect your strength. You need to train the basic movements your body uses every day. In this video, you will learn 3 strength exercises almost every adult should practice. These movements train your legs, hips, back, chest, shoulders, arms, core, grip, and balance. And the third exercise may be the most important one of all because it directly affects your ability to remain independent as you get older. Now let's begin with the first essential movement, the squat. You may hear the word squat and immediately imagine a bodybuilder lifting a heavy barbell in a gym. But a squat is not just a gym exercise. It is one of the most important human movements. Every time you sit down in a chair, stand up from the toilet, get into a car, pick something up, or lower your body toward the floor, you are using a form of the squat. The squat mainly strengthens your thighs, glutes, hips, and core. These muscles help support your knees, stabilize your body, and generate the power you need to stand, climb, walk uphill, and prevent falls. If your legs become weak, daily activities become harder surprisingly quickly. You may start using your hands to push yourself out of a chair. You may avoid stairs. You may feel unsteady when standing up. And because movement feels harder, you move even less, which can cause more weakness. That is why training the squat is not only about building muscle. It is about protecting your independence. The safest version for many beginners is the chair squat. Stand in front of a stable chair with your feet about shoulder width apart. Your toes can point slightly outward. Keep your chest lifted and look forward. Now slowly push your hips backward as though you were trying to sit down. Bend your knees and lower yourself toward the chair. Touch the chair gently, but do not collapse into it. Then press your feet into the floor, tighten your legs and glutes, and stand back up. As you rise, imagine pushing the floor away from you. The movement should feel controlled. Your knees should generally follow the direction of your toes instead of collapsing inward. Try not to drop quickly into the chair. The lowering part of the exercise is important because your muscles must control your body weight. If the exercise feels difficult, use a higher chair or place your hands lightly on a table for balance. You can also place a cushion on the chair to reduce the distance you need to lower your body. If the basic chair squat becomes easy, progress slowly. First, try standing without using your hands. Then lower yourself more slowly. After that, hold a light object close to your chest, such as a small dumbbell, a water bottle, or a backpack. You do not need to rush toward heavy weights. Your first goal is excellent control. Start with 2 sets of 8 to 12 repetitions. Rest for about 1 minute between sets. The final few repetitions should feel challenging, but your form should remain steady. Now ask yourself a simple question. Can you sit down and stand up from a chair 10 times without using your hands? For many adults, that simple test reveals more about functional strength than the number on a bathroom scale. The second essential exercise is the push-up. Again, many people hear push-up and imagine military training or someone performing 50 repetitions on the floor. But the push-up is really a pushing movement, and every adult needs pushing strength. You use this pattern when pushing open a heavy door, moving furniture, placing an object onto a shelf, pushing yourself up from the ground, or catching yourself during a fall. The push-up strengthens your chest, shoulders, triceps, and core. When performed correctly, it also teaches your body to remain stable while your arms produce force. The problem is that many beginners attempt floor push-ups too early. They struggle through a few poor quality repetitions, feel pain in their shoulders or wrists, and decide the exercise is not for them. But the push-up can be adjusted for almost any fitness level. The easiest place to begin is with a wall push-up. Stand facing a wall and place your hands against it slightly wider than shoulder width apart. Step your feet backward so your body leans toward the wall. Keep your body in a straight line from your head to your heels. Now bend your elbows and slowly bring your chest toward the wall. Do not allow your hips to move forward while your chest stays back. Your entire body should move as one unit. Pause briefly, then push the wall away until your arms are straight, but do not forcefully lock your elbows. Try to keep your shoulders down and away from your ears. Your elbows should not point directly sideways. Allow them to travel slightly backward at an angle that feels natural. Once wall push-ups become easy, move to a kitchen counter, strong table, or sturdy bench. The lower the surface, the more difficult the exercise becomes. Eventually, you may progress to knee push-ups or full push-ups on the floor, but there is no requirement to reach the floor version. A controlled incline push-up is far more useful than a painful floor push-up performed with poor technique. Begin with 2 sets of 6 to 10 repetitions. Move slowly enough that you can feel your chest and arms working. If you can easily perform 15 controlled repetitions, lower the surface slightly or increase the difficulty in another small way. One common mistake is allowing the head to move forward while the body stays behind. Another is letting the lower back collapse. Imagine gently tightening your stomach as though someone is about to tap you in the abdomen. This helps keep your spine stable. The push-up is especially valuable because it strengthens several muscle groups at the same time. You are training your arms, chest, shoulders, and trunk with one movement. And unlike many machines, the exercise teaches your body to work as a connected system. Now we come to the third exercise, the hip hinge. This movement is often ignored, misunderstood, or performed incorrectly, but it is essential for protecting your back and building strength in the muscles behind your body. A hip hinge is the movement you should use when bending forward to lift a bag, pick up a laundry basket, move a box, or grab something from the floor. Many people bend mainly through their lower back instead of moving through their hips. Then they attempt to lift an object while their spine is rounded and their legs are doing very little work. That does not automatically cause an injury, but repeated poor lifting habits can place unnecessary stress on the back. The hip hinge trains your glutes, hamstrings, back muscles, core, and grip. It teaches you to keep an object close to your body and use your powerful hip muscles to stand up. One of the best ways to learn the movement is with a wall drill. Stand with your back toward a wall about 6 to 8 inches away from it. Keep your feet about hip-width apart and soften your knees slightly. Now, imagine that your hands are full and you need to close a car door using your hips. Push your hips backward until they gently touch the wall. Your knees should bend a little, but this is not a squat. Your hips travel backward while your chest leans forward. Keep your spine long and your neck in a comfortable position. Then squeeze your glutes and push your hips forward to stand tall. Do not lean backward at the top. Simply finish in a normal standing position. Practice this movement slowly until you can clearly feel the difference between squatting down and hinging backward. Once you understand the motion, hold a light backpack, dumbbell, or shopping bag close to your body. Push your hips backward, lower the object along the front of your legs, and then stand by driving your feet into the floor and tightening your glutes. Keep the weight close. The farther an object moves away from your body, the harder your back must work. Start with 2 sets of 8 to 12 repetitions. Use a light load and focus on smooth movement. You should feel the muscles in your hips and the backs of your thighs working. You should not feel sharp pain in your lower back. The hip hinge is also the foundation of exercises such as the deadlift, kettlebell swing, and Romanian deadlift, but you do not need to perform advanced versions to benefit. Even practicing with a light backpack can improve how you lift objects in daily life. There is one more reason this movement matters. Strong hips help you walk faster, climb stairs, maintain balance, and rise from the floor. Your glutes are among the largest and most powerful muscles in your body. When they become weak, other areas may try to compensate. That is why the squat, push-up, and hip hinge work so well together. The squat trains your ability to lower and raise your body. The push-up trains your ability to push and stabilize your upper body. The hip hinge trains your ability to bend, lift, and generate power from your hips. Together, these 3 movements cover a large percentage of the physical tasks you perform in everyday life. You can turn them into a simple full-body workout. Perform 8 to 12 chair squats. Rest for 30 to 60 seconds. Then perform 6 to 12 wall or incline push-ups. Rest again. Finish with 8 to 12 hip hinges. That is 1 round. Start with 2 rounds, 2 or 3 times per week. A beginner may complete the entire session in less than 15 minutes. As you become stronger, do not immediately add dozens of repetitions. Instead, make small, intelligent changes. Use a slightly lowered chair for squats. Use a lower surface for push-ups. Hold a slightly heavier backpack during hip hinges. You can also slow down the lowering phase of each exercise. Progress should feel gradual. You do not need to destroy your body during every workout. Some muscle fatigue is normal. Mild soreness may happen when you begin. But sharp pain, chest discomfort, severe breathlessness, dizziness, or sudden joint pain are signs to stop and seek appropriate medical guidance. The greatest fitness mistake many adults make is waiting until they feel weak before they start strength training. Strength is easier to maintain than it is to rebuild after years of inactivity. You are not training only for how your body looks today. You are training for the person you want to be. 10, 20, or 30 years from now, you are training so you can carry your own groceries, so you can get up from the floor, so you can travel, play with your children or grandchildren, climb stairs, and move through life without constantly asking someone else for help. You do not need a perfect body. You need a capable body. Begin with the chair squat, the incline push-up, and the hip hinge. Practice them consistently. Improve them slowly. And remember, the most effective strength program is not the most complicated one. It is the one you can perform safely, regularly, and confidently for years.